Hello everyone, my name is Crystal Alcantara, and in this presentation I will be evaluating the efficacy and safety of the ketogenic diet as a weight loss therapy. There are four main parts that will be discussed in this presentation: an introduction to the ketogenic diet, select evidence from 3 trials, a summary of the efficacy and safety of the diet, and a practical summary for consumers. The ketogenic diet has been around for more than 100 years, used primarily in medicine to treat and manage epilepsy, especially in children. In the 1970s, a physician by the name of Dr. Robert Atkins popularized a diet very low in carbs for weight loss that began with a very strict 2-week ketogenic phase. In more recent years, more studies have been evaluating the ketogenic diet as a way to treat obesity and promote weight loss in obese individuals. Simply put, a ketogenic diet is rich in protein and fats and low in carbs. Carbs are the main and preferred source of energy for our bodies, and in the absence of enough carbs for energy, the body shifts to break down fats for energy. Stored body fat is broken down into molecules called ketones through a process called ketosis, and these ketones then become the primary source of energy for the body, which explains the name for the diet. Ketones can be measured using blood tests, breath tests, or urinary test strips. In essence, the ketogenic diet mimics a partial fast. During a total fast, or state of starvation, the body has no source of energy and therefore breaks down lean muscle mass for fuel. However, with the ketogenic diet, the ketones provide an alternative source of energy and help to maintain lean muscle mass. Some foods typically incorporated into the ketogenic diet are meats, eggs, cheeses, fish, nuts, butter, oil, seeds, and fibrous vegetables. The exact mechanism by which the ketogenic diet causes weight loss is still a subject of debate. One hypothesis is that the weight loss obtained with the ketogenic diet could be attributed to a reduction in appetite due to higher satiety effect of proteins, or in other words, increased protein intake can help to keep you fuller for longer. Other authors suggest that there could be a reduction in fat synthesis in the body, otherwise known as lipogenesis, as well as an increase in fat breakdown, otherwise known as lipolysis. Some authors claim the weight loss effect, mostly seen as body fat loss, could be explained by improvement in fat breakdown. One last hypothesis is that the body requires more energy to create more glucose or carbs for fuel, a process known as gluconeogenesis, as well as more energy to digest and utilize protein. This higher energy or caloric requirement can be hard to meet on a restrictive diet, which can inevitably lead to a caloric deficit, which causes weight loss. Although the mechanisms underlying the effects of the ketogenic diet on weight loss are not definitive, there is some evidence that suggests the ketogenic diet can sustain weight loss, especially when compared to other diet treatments. This first study I will be examining was published in 2014 by Moreno and colleagues out of a hospital in Madrid, Spain, and evaluated the efficacy of a very low-calorie ketogenic diet in the treatment of obesity. This was a prospective, randomized controlled trial that incorporated a 1-year follow-up period. This study involved 53 participants with the following characteristics: age 18 to 65 years old, obese, defined by a body mass index of greater than or equal to 30, and generally healthy. The participants were randomly divided into 2 groups, the low-calorie diet group, or the very low-calorie ketogenic diet group. Both groups were provided with additional external support, as the diet groups were assigned as part of an established commercial weight loss program. This support encompassed both lifestyle and behavioral modifications, such as diet and exercise tips. The primary outcome measures of the study were body weight, waist circumference, and BMI. Please note, for the purposes of this presentation, I will be mainly emphasizing the measure of body weight, since it is an outcome that can be compared across all 3 studies. The secondary measures of this study were blood pressure, pulse rate, lipids, diet adherence, body composition, and metabolic panel labs. Results of this study showed that starting at day 15, the weight loss was twice as high in the ketogenic diet group than in the low-calorie diet group. This difference in weight loss between the 2 groups was most evident at 2 months. The researchers found that the maximum weight loss was observed after 8 months of treatment, which suggests the importance of longer-term trials when studying the very low-calorie ketogenic diet. Even at 12 months, the difference between the groups was still evident despite some weight regain in the ketogenic diet group. The key findings from the study were that when compared with a standard low-calorie diet, the very low-calorie ketogenic diet was significantly more effective in inducing greater weight loss, greater BMI reduction, and greater waist circumference reduction. In regards to side effects and safety, the ketogenic diet induced more frequent manifestations of fatigue, headache, muscle weakness, constipation, and nausea than that of the low-calorie diet group. However, they were mild in intensity and transient, with most symptoms disappearing after the first few weeks. This second study was also published by Moreno and colleagues out of the same Spanish hospital 2 years after the first study that we just discussed. In this study, they aimed to assess the long-term effect of a very low-calorie ketogenic diet on excess fat stores, or adiposity, as a treatment for obesity. This was also a prospective randomized controlled trial like the first study, but had a longer study duration of 2 years. This study involved 45 participants with the same characteristics as the previous study: age 18 to 65 years old, obese defined as a body mass index of greater than or equal to 30, and generally healthy. The participants were randomly divided into two groups: the low-calorie diet group or the very low-calorie ketogenic diet group. The two diet interventions were identical to those in the first study, following the same caloric value levels, macronutrient distributions, and stages, and both groups again were provided external support via lifestyle and behavioral interventions. The diet interventions took place over a 12-month control period, with follow-up at 18 and 24 months to evaluate the participants' current health status as well as their weight and body composition. The primary outcome measures of this study were again body weight, waist circumference, and BMI. The secondary measures of the study were total body composition and visceral fat mass. Results of this study show that from the beginning until the end of the follow-up period, the amount of weight loss observed in the very low-calorie ketogenic diet group was double that of the low-calorie diet group. The maximum weight loss in the ketogenic diet group of about 20 kilograms of the initial weight was observed at 4, 6, and 12 months, with some weight regain seen thereafter. Despite some weight regain in both groups, there was still a greater reduction in weight loss in the ketogenic diet group compared to the low-calorie diet group at 24 months. Overall, the ketogenic diet spurred a greater reduction in body weight, BMI, waist circumference, and body fat mass, namely visceral fat mass, than the low-calorie diet group. Aside from the longer study duration, one of the distinguishing characteristics of this study that sets it apart from the first study I assessed is the stricter analysis of body composition. Specifically, the researchers observed a more significant reduction of visceral fat mass in the ketogenic diet group than in the low-calorie diet group, and this difference was observed even at 24 months. This yields important implications on reducing individual burden of disease in respect to excess body weight and exposure to adiposity. This study supports the notion that a ketogenic diet, a very low-calorie ketogenic diet, can promote lasting weight loss and adiposity reduction. This third and final study was published in 2016 by Mera and colleagues out of a university in Rome, Italy, and sought to compare the effectiveness of two different diets on body composition: a very low restricted calorie diet and a very low carb ketogenic diet with amino acid supplementation. They looked at which diet could better preserve lean body mass during weight loss and protect from diet-induced sarcopenia, a syndrome characterized by loss of muscle mass. This was a randomized controlled double-blind trial with a 3-week intervention period. This study involved 18 participants with the following characteristics: age 18 to 65 years old, overweight defined by a body mass index of greater than or equal to 25, a percent body fat greater than or equal to 25 for women and greater than or equal to 30 for men, and generally healthy. The participants were randomly divided into two groups: the very low restricted calorie diet group or the very low carb ketogenic diet group with amino acid supplementation. In addition to receiving a daily multivitamin and mineral capsule, all participants were asked not to change their current lifestyle habits. The primary outcome measures of the study were body weight, BMI, and total body lean mass. The secondary measures in this study were waist and hip circumferences, total body fat, and total body fat distribution. Mera and colleagues found that both groups had a significant decrease in BMI, a significant decrease in total body fat, no significant decrease in percent body fat, and overall they both had weight loss. The most conflicting result in the study, compared to the first two studies we analyzed, was the difference in weight loss between the low-calorie group and the ketogenic diet group. Although both groups lost weight, the reduction was greater in the low-calorie group compared to the ketogenic diet group. The leftmost graph shows the mean weight loss of 6.98 kilograms in the ketogenic diet group, which is greater than the mean weight loss of 5.97 kilograms in the low-calorie group. However, when we look at the weight loss in terms of percent weight loss of the initial weight in the middle graph, we see that the low-calorie group has a greater percent weight change of almost 1% more compared to the ketogenic diet group's weight change. Additionally, the study was unique in that it evaluated the total body lean mass as a primary outcome measure. The researchers found a significant decrease in total body lean mass in the very low-calorie diet group, with 3.3 kilograms lost, and although not significant, they found an increase of 1.92 kilograms in the ketogenic diet group. This finding suggests that a ketogenic diet is effective in weight reduction without inducing lean body mass loss, which prevents the risk of sarcopenia. Now that we have analyzed 3 trials evaluating the efficacy and safety of the ketogenic diet for weight loss, we can move on to a summary of the current evidence. In terms of efficacy, the ketogenic diet can be effective for weight loss, but there are many factors to consider that may affect the amount of weight that is lost. One important factor to consider in this diet's effectiveness, especially in the context of the 3 studies discussed, is the calorie level of the ketogenic diet. The fact that the majority of these studies presented combine their ketogenic diet with a very low calorie component makes it difficult to determine which factor is inducing weight loss. Next, the lack of a standardized definition for the ketogenic diet should also be considered. The main requirement we see is a very low carbohydrate amount in order to produce that ketonic state. All 3 studies combined their ketogenic diet intervention with a low-calorie component, but only one of them measured urinary ketones as an indicator for correct administration of the diet. Then there's the factor of combining behavioral and lifestyle modifications with the ketogenic diet. They may affect overall weight loss. Moreover, inadequate sample size and absence of adequate study duration or follow-up time were a theme throughout the studies evaluated. Lastly, we observed that all 3 studies still tailor their ketogenic diet intervention to each individual participant based on estimated calorie needs or gender. This implies potentially serious differences in the amount of weight lost on the ketogenic diet from one individual to the next. Overall, in terms of efficacy, the ketogenic diet can be effective as a tool for weight loss, but we cannot make concrete conclusions on the amount of weight lost or the rate of weight loss, as it depends on the individual. Additional research is needed to evaluate the diet's long-term effects on maintaining weight loss. Now moving on to safety. Results from these 3 studies suggest that using a ketogenic diet for weight loss can be safe, especially in terms of preserving lean muscle mass, when followed for a short amount of time and under medical supervision. When assessing overall safety of this diet, we again have to consider a multitude of factors. Diet duration and appropriate medical supervision are important factors. The longest study duration we saw was 2 years, so the safety effects of that diet beyond that time frame still needs to be evaluated. We saw that all subjects across all studies, despite being overweight or obese, were generally healthy. So we should be wary of the safety of the ketogenic diet for obese individuals with other comorbidities, such as diabetes, cirrhosis, or renal insufficiency. Special attention should be given to both macronutrient and micronutrient needs on a diet as restrictive as the ketogenic diet, with emphasis on adequate protein in order to reduce the risk of lean muscle loss. If you or someone you know is considering the ketogenic diet for weight loss, I would consider the following list of tips. This diet can be quite restrictive and complicated to follow, especially for a long period of time, which should be a deciding factor for you if you want to adopt this diet. I would recommend consulting with a physician and a registered dietitian for supervised diet management and to help ensure your safety while on this diet. If taking on this diet or any variation of it, I think a major takeaway from the findings of our 3 studies is the importance of incorporating adequate protein in order to preserve lean muscle mass. Also, ensuring adequate vitamin and mineral intake from a daily multivitamin is important to cover any nutrient gaps not fulfilled by such a restrictive diet pattern. The ketogenic diet is not recommended for individuals with certain diseases such as pancreatic disease, liver conditions, thyroid problems, or gallbladder disease. Those with other comorbidities, such as diabetes and renal insufficiency, should also be cautious when considering this diet. Overall, this is not a one-size-fits-all kind of diet. The amount of weight loss, the rate of weight loss, and the degree of weight maintenance are all subject to variation depending on the individual. So when considering adopting this diet plan for weight loss, it is important to keep those factors in mind as well as your own unique health and nutrition needs.